Yes, we're not really talking about the doctor strike, but could you bring us up to speed as to, just what you've done or how soon you think that they will come back to work? Because if you say that you've addressed most of their concerns, the question will be, why are they still at home?
Well, that's the question you should ask the NMA. The reason why I'm saying this is that even the National Assembly, both at the level of the Senate and at the level of the Federal House of Representatives, have intervened. And after brokering what was seen as an agreement, they still refuse to call it off. Elders of the profession have intervened. After what we thought would lead to calling it off, they still have not called it off. The governor of Delta State, a medical doctor, intervened, and he thought he has gotten it right. He was also disappointed. So many people have come. Even the president has held 2 meetings, 2 one-on-one meetings with the leadership of NMA. I don't know who else. We have prayed to God. We have involved everybody. I think the strike should be called off. We are pleading with them. But one thing I want to assure the country is that the Minister of Health will not check from his responsibility. We pray they call off the strike because we need them to be there. But if they didn't call off the strike, we'll take the second best thing, but our people must get health care. So I'm still appealing. We've done everything. I'm on air. I don't want to waste your time, because if we have to start going through 24 points, I mean, it's wrong. You don't have all that time. But just take it from me that we have, and Yomi can see me later. I'll give her all the things we have done point by point, and she can summarize it. I can assure you.
Now, this brings us to the next issue, which is the fact that if the government hospitals or doctors and government hospitals are not at work, it means that, most likely people will resort to the private hospitals. How are you collaborating with the private hospitals to ensure that they are also on board in this containment issue, especially considering that the very first place where this was discovered was a private hospital?
Well, the patient was covered at the airport, but because government doctors are on strike, he was taken to a private hospital. I guess if doctors were not on strike, it could have been either lawsuit or loot, likely, that the patient would have been taken. So it's not that the disease was discovered there, but the disease was diagnosed while the patient was not in a private hospital. But the idea that the patient was sick, and very sick, started from the airport. Now, you have asked a very pertinent question. We are trying to engage them. It's one of the strategies we've mapped out. Our people are now holding meetings with different groups of private practitioners, but that is one group we now need to work with seriously. Then, listening to the program you showed during the interval, I want to also reassure you that we indeed identified what was identified on that clip, which is that the young ones, the students, pupils and students, will need to do a lot more. So we are going to collaborate with the ministries of education, both at the federal and state levels, so that we can give information to the schools and the school children. So you are right, we need to do a lot more in engaging the private health sector, but we've started.
Okay, you said something earlier about working with the Ministry of Aviation. They've been told not to allow any corpses in from any of the countries that are already affected with Ebola virus, even the border patrols. But what about the illegal entry points? How are you going to, or how are you working to ensure that they do not come in through any of these illegal entry points? Because as we know, there are quite a number of them across the country.
Yeah, you are very right. You are very right. And that is one of the reasons why it's been difficult to just clearly say, close the borders. Closing a border is not like we have gates around the whole perimeter of Nigeria. If they were so, they would just go and close all the gates. But you have just pointed it out now, that they are indeed illegal land crossings, not even manned. So we are careful, because for now, I think we should encourage people to come through the mainstream, the main highway, and then we screen them there. If we close the few places we man and they begin to go through other places, they are no longer on our radar. And it's worse if we are blind to how people are coming. So it's made it difficult. But what I want to assure you is that at any stage where we all have consensus, no single person has all the wisdom. Once we have consensus that it will be effective, surely we'll recommend that, and I believe government will close the borders. But for now, in our understanding, we don't think it will be useful. It's likely to be counterproductive, but nothing is final. What is important is that we will do everything possible to protect Nigerians. We must. So the issue of border is a dicey thing. We have 22 recognized borders. We have presence in all the 22 recognized borders, but these ones you mentioned, that is where the challenge is.
Okay, talking about ensuring that Nigerians stay safe, let's look at the issue in Anambra State. What's the update? Do you have an update as to the cause of the death of that man?
No. The update I only have is to the extent that we have taken samples, but the result from the lab not been communicated to me. But I'm in touch with the governor and the government of Anambra State. So they are holding on now for the result, and then we'll take a decision. And then whatever is needed to be done, we'll take it off from there. But I believe by today, hopefully, the results will be out.
Okay, are we in touch with the American government? Because we understand that there was this serum that was given to some of the doctors who tested positive and they're responding to treatment. Are we in touch with them to see if we could also have access to that serum?
Yes, we're in touch with them. Yesterday, I spoke on telephone with the director of the U.S. Centers for Disease Control and Prevention, Tom Frieden. We spoke at length for over 20 minutes. And then since then, we've exchanged 3 emails. The last email we exchanged was just before I walked into your studio. And we're in touch with them. Now, yesterday, I inaugurated the treatment research group. Now, one of the terms of reference of that group is also to collaborate with similar working groups around the world. So I guess now that they started work yesterday, they would immediately get in touch with the Americans and understand what they are doing and whether we'll have access to a similar opportunity. But here, they also have opportunity of looking at their own options and developing something. Nobody says that new, fresh ideas cannot come out of Nigeria. We should not underestimate the intelligence of Nigerians, and I don't underestimate the intelligence of our professionals. That's why I decided to inaugurate that committee. I believe something positive is going to come out.
How long do they have? Do they have a time frame within which they're working?
You can be sure that I will never give them a time frame. It's a standing committee. Only if they can't cope because of age or they die, would they need replacement? But certainly, they don't have it's an indefinite period they've been given. As long as Ebola is an issue, they'll work on it. If they now get a treatment, we'll give them other jobs. There are some diseases, others that we still need to do a lot more. So this is just the beginning. Setting up that group was specifically for Ebola, but if they succeed with Ebola, we can give them other tasks.